Hi, Dr. John Torres here on my Doc to Doc series, where once a week I bring in an expert to talk about things medical, to talk about things health, and particularly talk about things concerning the pandemic, coronavirus, COVID, and those things that affect you, hopefully giving you some information you can walk away with that can help you, your family, your loved ones, your community get through this pandemic sooner rather than later. And very happy today to have with me Dr. Julie Morita, a fantastic expert. She is the she is the former commissioner of the Chicago Department of Public Health, and she was on the CDC Advisory Committee on Immunization Practices. She is also a pediatrician and the executive vice president of the Robert Wood Johnson Foundation. So Julie, thank you for being here with us.
Thanks so much for having me, John. Nice to see you again.
It's a font of experience, which is going to come in very handy today in our conversation. The one thing I want to talk about is mainly the children's vaccination that just got the emergency use authorization from the FDA and the recommendation from the CDC for 5 to 11 years old just this week. And so now they're starting to get shots in arms. How significant is this?
John, this is really an exciting moment. When you think about it, there's 28 million 5 to 11-year-olds in the United States. And these children have been really unprotected, other than the masks and the social distancing and the hand washing that we were having them doing. They really were not as protected as the rest of us in terms of being able to be vaccinated. So I was thrilled to see the FDA approve the vaccines for use last week, and then also the CDC recommending the vaccine for use. It's really going to make a difference in terms of keeping our children safe.
And Julie, I know as a parent myself, my children are adults now, but I know when they were children that as an adult, I would get a vaccine without thinking really much about it, making sure it's safe, making sure it's effective, but I wouldn't really be that concerned, more concerned with my children. And I know one of the things we've been talking with adults is getting the vaccine to help protect your community. Well, parents are saying, that's fine and dandy, but I'm more concerned about my child particularly. What are you hearing from parents and what are you telling them?
I think one of the key things to think about is that when the beginning of the pandemic, and even in the middle of the pandemic, we really focused in on how adults were higher risk. So seniors, people with underlying health conditions were at highest risk for getting sick with COVID and ending up in the hospital. And then we minimized the impact it was having on children. But really, millions of children have been infected with COVID, thousands have been hospitalized, and hundreds have died. And then we also have thousands of children who've had the severe inflammatory COVID disease, and that's significant. So having a vaccine available, we're really preventing serious infections, deaths, and hospitalizations. So I think we minimized it to a detriment because now people don't perceive the risk to children as being as high as it is.
So what are you hearing from parents themselves? Because right now there's essentially three categories. There are those, and it breaks down almost into thirds, but there are those who are waiting in line to get their children vaccinated. As soon as they got the authorization, they want to make sure they get their children vaccinated and protected. There are those that are waiting and seeing, and that's about a third middle. And then there's that one group that's just saying, I'm not going to get it regardless of what's happening. What are you telling those various groups?
So those that are wanting the vaccine right away, the key message is really look around to see where you can find it, because it is in doctor offices more than it was for adult vaccines, but it's not every doctor has it. So you might need to call your doctor, might need to call a pharmacy, you might need to go to a school or to a health department clinic. For people who are sitting on the fence, a lot of them are sitting on the fence because they have questions or concerns about the safety of the vaccine. They should be reassured that with the trials that were done, there were very few, there were no serious side effects. And the side effects that did occur were sore arm, redness at the site, swelling at the site, sometimes headache, sometimes fever, sometimes body aches. But those are all things that you can take care of with acetaminophen or ibuprofen. So there's ways to address those side effects. And then I think those people that are sitting on the fence will watch and see what happens with these real eager people who are getting their kids vaccinated and getting more comfortable as time goes on. They should also talk to their doctors, though, because their doctors can answer specific questions about their own specific children.
And you're bringing up a great point, because up until now, we've almost to a certain extent paid lip service to, talk to your doctor as an adult, but just, here's the information, get the information yourself and go get the vaccine. But with this one, parents are going to want to talk to doctors. What's the CDC doing to address the pediatricians, to get them and the family physicians, to get them that information they need in order to address the parents' questions?
Yeah, I've been in numerous discussions with people from CDC and also from other organizations, really looking to make sure that healthcare providers have the information they need, because healthcare providers are really a critical source of information and facts for parents. They were a trusted source. So, American Academy of Pediatricians, the American Academy of Family Physicians, CDC has been working together to really make sure there's ample information so healthcare providers can feel confident in addressing the questions and concerns of parents, and so that parents can actually feel comfortable getting their children vaccinated.
How important is it that they go to those sources to get that information?
Well, John, there's so much misinformation that's available. It's really hard to know what's factual and what is evidence-based and what is not. And so it really is important to talking to healthcare providers who have access to the scientific data and evidence. People can also go to the CDC's website to check out, because there's an abundant amount of information and resources available. But if people don't want to go to government sites, they can also go to healthcare centers. A lot of healthcare facilities have information on their websites. Academic institutions as well, universities have information on their websites. And then more and more community organizations are putting information and making information available, because there's been a real coordinated effort to make sure that community people have information they can share with their community members, because we know that not all people want to talk to healthcare providers. Some might want to talk to a community member.
Let me get your take on some of these facts or some of these things I've heard from parents that are oftentimes myths, sometimes myths based in fact, but just to see what the information is behind them. When parents are talking about wait and see, often they cite the side effects, or one of the reasons they're waiting to see what goes on. The big side effects they talk about is, they're going to be the sore arm, they're going to feel a little under the weather the next day, but myocarditis keeps popping up in those side effects. If you look at the numbers, and these are the latest numbers I have, 200 million people, almost 200 million people in the US have been fully vaccinated. We're talking 12 and above. The 5 to 11-year-olds have just started to get vaccinated. Out of those 200 million people, there have been 877 cases of myocarditis, 877 out of 200 million. On top of that, if you look at the deaths from myocarditis, and this came up in the ACEP meeting, there were nine deaths they looked into. Out of those 9 deaths, none of them were attributed to the vaccine itself. There were a couple they're still looking into. Is this an overblown issue? Is this something the media has pushed out there? Is this something parents need to be concerned about, or parents just need to be aware about?
Yeah, I think 2 things that I think are really important to talk about. Number one is that COVID itself causes myocarditis.
And it's a worse myocarditis.
It is a more serious myocarditis in those people who have gotten myocarditis associated with the vaccine. The other part about it that's important to keep in mind is that for those people who got myocarditis post-vaccination, the majority of them were in a certain age group. They were older males, older than 5 to 11-year-olds. They're not older males, but they're like 17 to 24-year-olds had the highest risk for myocarditis post-vaccination. So the risk to a 5 to 11-year-old is much, much smaller, and it's much smaller compared to the risk of getting disease and getting myocarditis. So there is this issue of myocarditis being associated with the vaccines, but it's a small risk, and also it pales in comparison to what happens when people when they get COVID and get myocarditis as a result of the disease.
Last week, I had a similar conversation with Dr. Buddy Creech, and he was saying that 5 to 11-year-old group, they're not as concerned with myocarditis like you mentioned there. And part of that has to do with puberty and the hormones that happen after puberty. And they think that might have something to do with the myocarditis. So this isn't a group that they're terribly concerned about.
Correct. I mean, I think that's a key thing to keep in mind, is that this group of people at 5 to 11 years of age are at lower risk than the group that had previously been identified. And so for whatever reason, that concern about myocarditis should be much, much lower.
And the other big one I've heard about, and I've heard about it many, many times from parents, is the fertility concern they have, which, from my understanding, no indications anywhere about any fertility issues with any age groups. How would you address that?
Right. I think, John, the data are not there. There's no evidence to support that there's a problem with fertility post-vaccination. And I think that's the fact. And I guess that's the other reason I think people really need to talk to their healthcare providers, because where you're seeing that kind of information pop up is not from healthcare providers, is not from credible sources. It's more from social media and other places where this kind of misinformation can be disseminated easily.
When the vaccines first came out, there was an issue with distribution, and we had those big tents set up and mass distribution sites. And then there was a big issue with equity among the distribution, especially in areas that were harder hit, those communities of color and more impoverished communities. Is that a concern with children's vaccines?
This issue is an ongoing concern. I mean, when you look at who has been impacted severely by the pandemic, it's really been our low income, our rural, our communities of color. Those are the people who've really been hospitalized more, have died more overall. And they had problems accessing the vaccine when we rolled out the vaccine initially. It is critical that those populations get the vaccine and have access to it. Among the surveys where they talked about children or parents being hesitant about getting vaccine or being eager to get the vaccine, they also had parents express concerns about not being able to take time off from work to get their children vaccinated or to care for them if they have side effects. These are significant issues, and having paid leave for parents is critical for people to be able to get the support that they need to keep their children healthy or to care for them when they do get sick. So, I think these equity issues are just significant, and they're not just limited to adults, and they have to be paid specific attention to now.
Yeah, you bring up an interesting point, because just today, the White House released their guidelines for the mandates for vaccines that are going to be implemented starting January 4th. One of those are OSHA mandates. And what they're going to say is that any employer with 100 or more employees has to provide a paid day off to go get vaccinated. That's for the employee, but they didn't mention much about the children themselves. So where do you think we should go with that?
I think it's important for there to be paid leave that's flexible enough for people to care for themselves or for their children. It's essential for us to really protect our children, and for people to be worried about not being able to take time off from work so they don't get their children vaccinated. That's unacceptable. I think the other thing, though, that's happening is that those that are providing vaccines recognize that some people may not have those protections. And so they're scheduling clinics after hours, on weekends, they're having walk-in appointments. So it's not so difficult to get appointments. But I think we just have to continue to be vigilant about what systems are in place so that people don't have these barriers to getting vaccinated.
And to keep an eye on everything. One of the big things that came up in the VRPAC meeting was a concern about mandates, and the concern that if they had voted a certain way or mentioned certain things, that mandates for children would be implemented, and they didn't feel we were at that stage yet. Where do you stand with that?
So, as a pediatrician and a person who's been in public health doing immunizations for a number of years, I know how critically successful vaccine mandates have been in terms of prevention of childhood diseases. The school mandates have really prevented measles from becoming a serious threat to our children. Polio is no longer a threat. Those kinds of mandates really are important. And then you look at healthcare providers. Healthcare providers are required to get flu vaccines on a regular basis. Those mandates really, really do work. But we also have to make sure that there's abundant vaccine available, that it's easy to access, that people have an opportunity to have their questions answered and their concerns addressed before these mandates are put in place for children. Because I think the vaccine is just newly available, and there really hasn't been time to make those systems, ramp up the system so that people can be optimally and easily vaccinated.
It's interesting because California is going to implement essentially anybody going to an event, an arena, anything like that, 5 and above, are going to need to be vaccinated. Is that something you see in other parts of the country or spreading nationwide?
I think it's possible for those kinds of optional social events to have those kinds of requirements in place. But when it comes to requirements for school entry, which is just, we want our kids to be in school, they learn better when they're in school, and they can do things like wear masks, have appropriate ventilation, appropriately distanced. I wouldn't jump to do school mandates right away until we can make sure that our children have a chance to get vaccinated equitably, fairly, efficiently, and safely.
Some of the questions I've had, and I'm curious about your answer to these, because one of the things I love about getting viewers' questions and parents' questions is they often ask things that I don't think about, and sometimes experts don't think about. And I know recently it's been popping up a couple of times, but what if somebody gets a vaccine when they're 11 years and 11 months and a couple of weeks, their first vaccine, and their second vaccine is going to be when they're 12? Should they go for the first vaccine, that 10 microgram, the second vaccine, the 30 microgram, or how does that work?
So the trial that was done was using the same dose of the vaccine for the first and the second dose. And so it's likely that the recommendation will be to complete the series with that same dose if possible. But we always have some flexibility in terms of administering another dose if the other dose isn't available, because they are different. And so I think it'll be interesting to see what plays out. What happens typically is CDC will give an approval, and then the written guidance comes. And I believe there'll be some specific guidance regarding that particular issue in the near future.
Oh, great. And the other one I have, which I think is very interesting, is my 10-year-old weighs more than my 12-year-old. Why is my 10-year-old getting the small dose? My my heavier weight 10-year-old getting a small dose, my lighter weight 12-year-old getting the bigger dose.
I mean, again, it's so funny that I had a colleague at work ask me that exact same question. And so I'm not surprised that you're asking that. The answer, though, again, goes back to the studies and how they were done. The study that was done for 5 to 11-year-olds was based on the third of a dose. The study that was done for the older kids was based on a full dose. And so I suspect that either dosage would work well for either child. But I think I would look to CDC's guidance to see what they actually say in those kinds of circumstances.
And being a public health expert, and this will be my last question. The last question will be about bottom line for people to give them some hope and inspiration moving forward. But second to last, as a public health expert and as a pediatrician, how awesome is it that now we can vaccinate the vast majority of the country?
It's truly remarkable, John. I think this is the moment that we've been waiting for. We've had so many concerns and hopes, excitement about potentially the pandemic ending, to have them crushed by the next wave of disease. I think what we have with this opportunity is 28 more million people can get vaccinated than could previously, and we'll hopefully get our vaccine coverage levels high enough. At a point when we actually have lower rates of disease, it's going to be critical to watch and see what happens with disease activity, though, because it's not enough just to have high coverage levels. We've got to make sure the levels of disease stay low. So I'll be holding my breath to watch and see what happens, but I'm hopeful that these vaccination efforts for children will make a difference.
Great. And Julie, just give us a bottom line here. What's your bottom line going forward with the pandemic? We've been through 4 waves. We keep talking about the light at the end of the tunnel. What would you tell people?
I'd say vaccination is the key to our getting out of this pandemic. We really need to optimize vaccination for adults, for children. Anybody who's eligible should get vaccinated.
Excellent. Julie, thank you so much. And again, Dr. Julie Morita, she's the Executive Vice President of the Robert Wood Johnson Foundation, pediatrician, and a good friend of the show. Julie, thank you very much for being here with us and giving us all this information.
Thank you. Nice to see you.